Aloha and good morning, everyone. Thank you so much for being here. We're going to get started soon. For those of you that are able to look at the slide that's on your screen or on your phone or tablet, this is just a review of the toolbar and how to optimize Zoom webinar. Our biggest reminder today is to please don't log into Citrix or your VPN. This will help us optimize the sound and the audio for everyone if you're working from home or if you're working from office. You can simply log in from Zoom's website or from the Zoom app if you have it installed. In the chat is the webinar ID and the phone number for you to call. But again, please don't log into Citrix. At any time, feel free to insert the questions you might have. You can do so anonymously into the Q&A feature, which you'll also see at the bottom of your toolbar. We have a chat. We'll be sharing some resources there. All of the resources will be made available to you and posted on Aloha Lines with the video later. And then we'll have a couple of polls that pop up on your screen. Again, they're also anonymous. We thank everyone for making this as participatory as possible. We wish we could be having this training and this conversation with our esteemed community leaders in person, but this is a great way for us to optimize what would be normally a regular Zoom meeting into a Zoom webinar feature. So we're getting ready to start. I just wanted to remind everyone that this session is being recorded. So if you or any of your staff want to watch this session back later, we will load it onto Aloha Lines and onto YouTube. Episode 1 is already up on YouTube now, featuring our session on sexual and gender minorities health. So feel free you don't have to, diligently take notes or anything today. You can just be present and listen and be a part of this virtual conversation more actively. So thanks everyone again for joining us. I'm going to stop the screen share really quick so you can see everyone's faces here much more easily. So we're so excited today to have our second episode. It's really wonderful to welcome esteemed Native Hawaiian, Pacific Islander, and Micronesian community leaders. Today's episode for AlohaCare's webinar, Enlivening a Culture of Health, will focus on why culture and language matter in Hawaii. So we just thank everyone for committing to your better understanding of the needs of our members, of our communities that we serve, understanding the social and cultural determinants of health, and being a part of how we outline a strategy and tailor our approach forward. This webinar is intended to be a safe, anti-racist virtual space that leads by the values of Hawaii. So all questions and comments and examples are encouraged, but any form of racism or discrimination does encounter a zero tolerance for us. It's really important that we have these conversations in safe and respectful ways, though we all are learning and we're all on a spectrum and growth of development. So I'd like to dedicate today's webinar to our ancestors. When we as Native Hawaiians and Pacific Islanders talk about our culture and our language, we start first with our ancestors. For those who have not met me yet, my name is Kealoha Fox. I'm helping to lead this series and moderate today's session. I'm going to start with our first poll just to wake everybody up this morning. You're going to see it pop up onto your screen. Go ahead and just take a guess of what you think is the right answer. Chelsea will be collecting the responses for us, and then we'll share these back later in your folks' resource sheets. So the first question is, do you know how many Hawaiian islands make up the archipelago? Lots of votes coming in. Awesome. So as you're responding to the poll, I'm going to share a little bit about the national culturally and linguistically appropriate standards that are meant to advance health equity, improve quality, and help eliminate health disparities. There is a blueprint established by the US Department of Health and Human Services. There's 15 standards and one principal guideline to help organizations like us be more effective, more equitable, and understand what care is needed in the communities we serve through respectful methods of quality and service. There's also important reasons why AlohaCare has agreed to adopt these standards and implement the new in-class blueprint in our organization's cultural competency plan. All right, lots of votes coming in. I'll be really impressed if anyone is simultaneously Googling this early in the morning. I know this is probably many people's, either their first or second meeting of today. So if you're simultaneously watching the webinar and Googling, you are a multitasking expert on this Wednesday morning. All right. We're going to end that first poll for now and then jump back into welcoming our esteemed panelists. Today's episode 2, Culture and Language Matter in Hawaii. It's incredible to honor and share space today with Josie Howard from We Are Oceania, Mahina Paishan Duarte from Bye Bye Collective, and Halaiwalu Wakalahi from Hawaii Pacific University. I have much more to share in their biographies and about them. We're going to do it in a more of a conversational style in a minute. But before then, this is a reminder of these are the in-class standards that we have agreed to adopt and support. So that principal standard is the one that we want to really keep in mind today as we listen to our guest speakers, their expertise, and the recommendations they share. It's that our services and care is responsive to the diverse cultural health benefits, beliefs, practices, preferred language, and communication needs. And that there are these 3 key intentions laid out in the in-class blueprint: to advance health equity, to improve quality, and 3, to help eliminate healthcare disparities. There are 6 reasons why the US HHS recommends these that include increased quality of care because of the changing demographics, not only across the country, but in Hawaii. To link to the marketplace, open enrollment does start on November 1st and goes to December. That's incredibly important to our Pacific Islander communities. Address the health disparities, which may come up in today's episode. Of course, there are legal mandates, language rights or civil rights, and helps us to decrease the liability of our organization. So with that, I'm going to stop sharing again, and I am going to have an opportunity to open up today's session with our leaders here in what we would call a kuka style. We are having a discussion. Reading a biography is one way, obviously, for us to get to know one another. But in our community, active discussions, listening, sharing commonalities is the great way to actually get to know each other firstly, rather than reading off of our biographies. In Hawaii, this starts with, sometimes some of us went to the same school, maybe we worked at the same place, and maybe even through these kuka discussions, you find out you're related to somebody. That's a part of getting to know someone. That's a part of building relationships, rapport, trust. We call that pilina here. And so it's important as we moderate this discussion that we start with pilina first, because we are part of the same community and we all have these same goals to improve health equity and decrease health disparities. So I'm going to start actually first with Dean Dr. Halaiwalu Wakalahi. I'm so excited that every week I get to start my week with Dean. And I call her Dean because I am trained as an academic. And when you ascend to that level of leadership and responsibility in academia to become a dean, especially if you're a woman, especially if you're a woman of color, that is something that we celebrate. And so I always call her Dean. And in every meeting, there's always somebody of like, who's Dean? I don't see a dean in our participant list. And Balu's laughing right now because it's just how that's part of our rapport and that's part of our pilina. But every week we start together on the Native Hawaiian Pacific Islander COVID-19 response team. We co-chair the policy committee. It's wonderful to work together with you, Valu. I wanted to start just by talking about, what's your passion? What are you working on right now? What's top of mind for you? You have so many students under you. You just welcomed a new cohort of nursing students. Tell us more about your passions and what you're working on.
Thank you, Dr. Fox. Truly a humbling experience to be invited to be a part of this panel, and I certainly I will always remember that I am the investment of many. So for that, I am truly grateful. Those who have come in the past and those who are going to be coming from the future, I am truly an investment of many. So, as a Pacific American woman, immigrant, born in Tonga and raised here in Hawaii, who sees the world through a cultural lens and is grounded in cultural values, I certainly, my passion is advancement of Pacific women in academia and creating those pipelines and pathways for socioeconomic mobility through higher education. And in my mind, I certainly hope that becomes a typical topic of conversation whenever we work with Pacific people, in any situation, whether it's in school or as clients or patients or consumers of products that we produce. I certainly hope that higher education is part of that conversation. I went to La'i Elementary, went to Koko High School, BOA Hawaii, University of Hawaii, University of Utah for the PhD in social work, which is my background. But at the end of the day, I truly believe that one of the things that have kept me grounded throughout these years have been those cultural lens, the way that I see the world through those cultural lens. So right now, and we're working on a million things. However, a few things that I think is important to point out. Part of our strategic plan here in my College of Health and Society at Hawaii Pacific University is to increase our number of NHPI students in nursing, public health, social work, and then of course now a developing DPT. We're working on developing and creating a student research center, which is funded by NIH and IGMS. And the genesis of that was the indigenous Pacific people and looking at the health disparities, lack of health research, as well as lack of trained investigators. So I think what the funnest thing about this research center is that we're using entrepreneurial research as that's the catchphrase or the catch practice. And I think for us, I have been told a million times, my Pacific colleagues, that entrepreneurship is a cultural concept. Our ancestors use that. And so it's going to come natural for a lot of our students to be entrepreneur in their research. And then, of course, every week I get a chance to start off my week with the wonderful Dr. Fox and Dr. Daniels and everybody else in the policy committee, which for me, that's my energizer each week. And then, one of the things that I think it behooves all of us to be worried about is this idea of being underrepresented in higher education. And as far as I'm concerned, it's wonderful being a dean. It's wonderful being able to climb the ladder. At the same time, I shouldn't be the first and the last. I should just be, this is just the beginning, and that we're creating pipelines for that higher education. Anyway, that's me in a nutshell.
Oh, mahalo. And there's just so much and important gems that you just shared about the nexus between quality education and quality health in someone's life. And so thank you for weaving that together for us. And speaking of weaving, I'm going to go to Josie next. I'm wearing my pua. Josie and I have been active at the federal level to help do everything that we can to restore COFA Medicaid coverage. And this is from one of the trips where we were in DC. We were doing Congressional Hill visits several years ago. And I was actually just looking at those pictures the other day because they came up in my memories, on my Facebook memories. And there was me and Josie and Auntie Innocenta and Helen and Diane. And it was, we had these, smiling faces talking to some of the most powerful congressional leaders about why healthcare coverage is so important for NHPI communities. And so I wore this pua for you today, Auntie Josie. Thank you so much for being here. You're pretty much one of the most busy people right now. So you taking time for us at AlohaCare is a real humbling honor for us. What's at the top of mind for you this week? What are you working on? Where's your passions taking you, Auntie Josie?
Thank you so much, Dr. Fox, and thank you, Dean. And I want to say good morning to another sister, Mahina. Thank you so much for this space, and it's really an honor for me to be among you, wonderful, great, powerful women, to share my story too, and the work that I am doing in the Micronesian community here in Hawaii. It's has always been my passion. As I reflect on that question, I'm like, okay, so where do I get this from? Why am I doing the work I'm doing today? And it really started at home. This allowed me to go back in time and go back into where I came from to understand why I do the work today. And when I was growing up as a little girl on a small island in Micronesia in Chuuk, one of my family's core duty was to feed people. And for those that are familiar with atolls and the resources we get on those atolls, my island it's fortunate that it's one of the bigger islands in the atoll that I come from. The rest of the islands the atoll I come from is called Namonweta, which literally means this islands of, is islands that are inhabitable. Like nobody can live on those islands because they're bird and turtle islands. But somehow my ancestors were able to cultivate and make those islands livable. So, but then it became our duty on this bigger island to feed the other islands that in times of famine, we always experience famine, or even if it's just a regular season, people would run out of food and they would sail on canoes to my island to pick up food. And my mom just fortunately had the responsibility that, with the taro badges. And so we would feed people. We would go and get food and, get onto the canoes, and then off they go back to their islands. So when I look at what I do today and why I'm passionate about the well-being of my people and well-being of just people that come to be in my space, I think that's where I got it from, the value that I got from my family and my island and that small community that I grew up in. That is just became my responsibility to make sure that my community is healthy, it's fed, it's taken care of, and it's for a greater cause for the whole community. So if we're not okay, the community that we live in is also not okay. So it becomes my duty to also make sure that we're here in Hawaii, that I am also contributing, and our health is, our well-being is okay, so that the whole Hawaii community is also okay. And that's exactly what we're doing at WOW. I feel like my work is on multiple layers and in different directions. I'm carving a canoe that I need to navigate, lead it out of the reef to get into the open ocean. But at the same time, I have to take care of, the needs. So it's complicated, but the immediate need is right now with COVID is to make sure that people are safe and that we stop the spread in our community and that they get the need they needed, like food and PPE and things like that. I'll contribute more as we go on, but that's where I get my passion, and that's what I focus on right now. And I agree with my colleague and with Dean. That's my passion too. I really, being the well-being of our community is there's so much aspect of that, and part of that is higher education for more of us. Yeah. Thank you.
Thank you so much, Auntie Josie. You just wove in another important area for us to consider today, and that's our relationship with the environment. We're so honored and thrilled that you're able to tell us these stories about your homeland and what it's like in your islands and atolls. That's really special to us, and that is something that we must deeply consider when we think about the health of a place as it relates to the health of the people through our environment and the ways which that environment produces our food and our medicine and so on and so forth. So thank you so much for bringing in that that added layer. We're going to have much more to talk with you about as you lead, as you know, locally and nationally, the Pacific Islander response work for COVID. So we'll definitely want to ask you more about that and how we can help and learn more. And so then I'm going to take us to Mahina Paishan Duarte, who many of you have been able to see with us in other sessions over the past month at AlohaCare. Mahina and Vai Collective are helping to steward some of these conversations in meaningful ways as a woman business owner, as a mom, as somebody who has worked in a range of industries. For you, Mahina, what's top of mind for you this week? What are your passions leading you towards? And what are some of the exciting work that's coming up for you right now?
Aloha kakahiaka yakako to you, Dr. Fox, to Dean, and to dear sister Josie. Aloha, and to all of those who are sharing space. You know, I'm on this kind of campaign to help all Native Hawaiian and Hawaii business owners to remember that our aina, our land, is our ancestor, and that our unique competitive advantage in the world is our ability to foster genuine connections. And so I want to speak a little bit more to that, but what I'd like to do is I want to call our ancestors to sit with us and preside with us, if that's okay. This mele was taught to me by another, esteemed researcher, Dr. Kalenu Uhiva, which many of you had the opportunity to interact with. Hina hanaya kamalama hina ai malama hina kama hina kawa hine ume ho mai kiola ya kako ho mai kamana ho mai kiola iola oi iola we a mama uanoa walele wale akume. May you thrive so that I too may thrive, so that we may all thrive. And that's just going to be my theme that I really want to just go back to throughout our conversation this morning. And it ties so, it just basically affirms and reinforces and props up what my colleagues have shared. And one thing I want to really point out is that why is it, if you look at the Haumea Native Hawaiian Health Report, why is it in 2020 that less than 15% of all women-owned businesses are owned by Native Hawaiian women? Why is that? Why is it that Native Hawaiian women are paid 71 cents less for every dollar than men in Hawaii? So if we are committed to this idea of thriving families, thriving communities, thriving families, thriving individuals, wouldn't we invest our resources, our focus and our energies on the caregivers, on those that are not only the caregivers, oftentimes the healers, oftentimes those that will create the meals, bring community together, as Sister Josie shared. So I want to challenge us in our conversation this morning. Like, what more can we do? How can we leverage our resources, not just financial resource, but how can we leverage, how might AlohaCare, how might Vai Collective, how might Hawaii Pacific University, we are Oceania, how might we leverage maybe our social capital, our political capital, to really, address some of the needs among our marginalized communities. You asked me what my passion is. My passion is thriving Hawaii and thriving peoples. So for me and for all of us here, our health is directly connected to the health of our land. So if we do not address that, if we don't address the health of our land, the health of our oceans, the health of our streams, the health of our watersheds, the health of our forests and our people, then the work that we do will be less impactful, because the health of our land is directly connected to the health of people. And we know that when we look at all the climate statistics, my colleagues here, they are our kua'ana, we say. They are our older siblings. Hawaiians, we are the youngest culture in Hawaii. And we have a unique responsibility because we had the fortune of inheriting all of that, those thousands of years of ancestry and ancestral intellect from our sisters and brothers of Tonga and Samoa and of Micronesia. So we know that we need to better care for our planet. We know that we need to better care for Hawaii. We know that we need to better care for one another. And just lastly, I spoke with some legislators 2 days ago. And Grace, I think you folks know this already, but it's just still settling in me. The state is looking at a $3 billion financial shortfall over the next 2 years. So we, even more so now, we're going to have to rely on one another and our connections and our relationships beyond the dollar. That's the only way that we'll be able to make sure that we care for those who most need health care. Mahalo ke aloha.
Mahalo nui, Mahina. Thank you so much for helping to describe and illustrate what's actually an ancestral model of the social determinants of health. You know, Polynesian, Melanesian, Micronesian people are very, we're very systemic thinkers. We think about the whole ecosystem, and that is so much actually of what the social determinants of health model was created back in the 80s. And actually, these topics are all top of mind. This week is the American Public Health Association's annual meeting. I got to hear from Dr. Fauci yesterday in one of the sessions. These conversations is exactly what the nation's top leaders of health and human services are discussing. And so it's just really incredible that you've been able to weave them into our conversation here this morning so intimately for our organization. I'm going to start with just some popcorn questions, and then we'll go into the full kind of group discussion. Valo, I'm going to come back to you. So you're educating Hawaii's health workforce at Hawaii Pacific University. You know, what are some of those core goals that you're embedding into learning requirements, and how the classroom is translating into Hawaii's workforce and social service sector? You know, what are you seeing, and how does culture and language play such a vital role in the ways in which you're educating this workforce for us?
So I feel blessed every day, in fact, to have kuleana over nursing, public health, social work, and the developing DBT program, because that gives you the whole continuum of health. I think one of our primary mission is that we produce healthcare professionals and leaders. And one of the things that we emphasize, and I say it all the time in orientations and wherever I go, where I get an opportunity to speak to our young people or our students here, that we want them to develop both caliber and character. That it's, yes, you're going to know the skills, but at the same time, you have to be able to relate to people. You have to be able to know where they're coming from. And so, you know, the embedding of the core values, HPU's core values of aloha, pono, and kuleana, and just basic decency and respect for people is something that we try our best to do. So when they're coming through the door, by the time they leave, that's something that they're going to go with. We create space for interprofessional education, because we do know that challenges are multidimensional. If you come in and you're a nursing professional, you're not going to just see a person that comes in just with a sore arm. The person is probably worried about something else. And so with the interprofessional education, that's something we emphasize. we try to help them, we facilitate space for them to find someone to help them paddle their wa'a, a faculty mentor or something to that effect. We emphasize, globally ready, culturally responsible, and community engaged leaders and professionals. And in so many ways throughout the curriculum, we try to make sure that that's done, not just in the classroom, but also in simulation, but also in practicum, in programs that we do as a whole college. Another thing that I think that we have emphasized that I think is really, really important for our young people is civic and community engagement and lifelong learning. That the COVID-19, the Black Lives Matter, this election is gonna mean something for policies and practices of their discipline, and they're all health disciplines. So I think that's something that we have embedded in our curriculum and in our programs that I think is wonderful to be able to translate to the community and to the workforce. So we kind of work backwards, and I say this all the time, and I think people are beginning to get tired of hearing me saying it, but our community is our mirror. So we have to be competent and inspiring. So if we look at the community day in and day out, and the community not looking too shabby, we have to come back to the table, to the drawing board. We have to change, just like Mahina was just saying. We have to come back to the table and see, so why are we disproportionate? Why are our health disparities is going crazy? The community is our mirror. So when we're looking in the mirror, we hopefully see a community that's thriving and that they're moving forward. Culture is a lifeline of Pacific people. I'm just going to specifically talk about our people. It's the lens we see the world, it's the tools we use for living. So if you extract culture from a person that comes to see you for help, or a student that comes through our program, I think it's not just a disservice. In fact, that's an understatement. You won't be able to help the person because that is their culture. It is their lifeline. And so, again, in fact, I think it's close to being criminal to be able to extract a person from their culture. So Pacific health is very intersectional and very holistic. So in that sense, we certainly hope the professionals and the leaders that we produce out of our College of Health and Society, that they have those lens. Everything else, they get that. They get the skills, they get the knowledge, they get cutting edge skills and knowledge. But I think that relational piece, that's something that we try to make sure they get before they get out. Because the answers are probably right there, but we haven't been able to facilitate the answers coming out of community. And so, so those are some of the things that I think are important and transferable from the classroom, especially here at CHS, to the community.
Oh, mahalo, Dean. I for folks who maybe don't know, fun fact about me, I completed my undergraduate degrees at Hawaii Pacific University, and this is actually the place where I learned interprofessional communication, interprofessional collaboration, that it takes physicians and nurses and social workers and attorneys and psychologists and everyone working together with pharmacy and physical therapy to really make the whole healthcare system work and to be effective, especially in the community health centers where I was trained. And so just thank you for bringing that forth. And I'm so proud to be a graduate of this program and to continue to be a messenger that we have high quality education and high quality healthcare right here at home in Hawaii. And Josie, I'm going to come to you. You're seeing just some major culture and language barriers happening in the state's COVID response efforts. But on the other hand, I just watched one of the most beautiful PSAs I've seen produced with you and We Are Oceania and Partners in Development and Kokua Kalihi Valley. In other ways, I'm also seeing culture and language as such an asset for public awareness, education, and trustworthy information reaching our communities. Tell us a little bit more about that work that you're doing and what you're seeing as the most valuable right now for us to pay attention to.
I know, I think it's so common for people to say culture and language are barriers. Um, and again, I'm going to go back to where I grew up. Honestly, when we have visitors to my island that don't speak our language, it's never a barrier. It's the universal language of kindness and aloha that, you know. So my response to that question first would be, you know, the response to our community and maybe those barriers, it's not so much because of the culture itself, but maybe the fear of that there's a difference. So like my experience as a Micronesian in Hawaii is, it's almost like because I'm Micronesian, automatically people put up a wall that, oh, I don't know how the Micronesians do this, how they do that. And so the culture and language became a barrier. So to me, it really boiled down to the lenses that we use when we serve people. And as a social worker myself, I learned that along the way. And that is to see people where they're at. As a professional, that is your job and your responsibility. So because I would, with this work right away, and I think Dean can relate to me on that, and even, I mean, all of us, I think, because we stand in the middle of between our culture and the you know, the system or the way we do things today. And so you know how exactly your community is going to react to this type of uh, pandemic or emergency, and then you also know how the other, like how the mainstream is going to think of it. So right away when this hit, I knew that I had to do something to quickly communicate to my community, because I know that they will have solution to it. It's just a matter of communicating across and what lens that they're using to see through, and also for the other side to see our community, so that the help can come and connect, right? So, oh gosh, where am I going with this? I get excited, but with that, you know, thought and attitude in mind, right away uh, we, it's like cultural values came up, and we had to operate through that. And this is why we're able to do the work, and we listen to the community and listen to what they need, and also help them to guide them to help us understand how do we bring the message so to them, so that they can help us make the others understand. Does that make sense? I don't know if it makes sense, but that's exactly what we did. And every day in and day out, we listen to them, and we learn how to build our initiatives to be able to address the need directly. So culture has actually become an asset, and I want to emphasize that our culture, it has always been a strength base, and if we just remember that, you know, that in everything we do, and I think that's one piece of this conversation that is so important. Our ancestors had taught us how to put in system that is taking care of things even before they happen. I mean, I remember my grandfather used to say, okay, you need to go get firewood right now because next week it's gonna rain. I'm like, how do you know that? You know, he listens to the insects, and he sees the, you know, like the cloud and all those things. But and then the way we respect each other, like how we dress and how we bow down when our brothers are there. I used to get confused, and I used to say, why do I have to, you know, like, and then here our children are being, how would I say, they're being teased because they wear the skirt. But when I look into the value of those things, those were all preventative. It's preventing, you know, sexual abuse, all those things. And it's all about relationship. It's about security of a community within that small community that we live in. And so I guess my job is really to see that and how does it fit into this new world. And so with COVID, we applied the same thing. How do we take care of this kind, and how do we fit it into this world? How do I, without the land now, without the resources from the land, how do I take that and fit it into this? And I think for me, I had to rely on my knowledge because I don't have the resources anymore, you know, but I had to rely on my knowledge, and I had to rely on the relationships in the community. Like I think Mahina was the one who pointed that out. In order to take care of the community and to make sure the well-being of the community is being taken care of, and it's okay. Yeah. Sorry, I got all excited about that.
I get excited too, and I wanted to share another reason why I got really excited. After Mahina blessed us with the Oli, it actually started to rain pretty hard here at my home in by the mountains in Kunia. And Josie, as you mentioned, your papa, it really started to rain really hard. So I just wanted to bring that into the space of when you call upon your ancestors, and in this case, we are asking them to be a part of this conversation and lead us to the future. I can't help but just share with everyone, we have, you know, a tremendous amount of our staff is listening right now, that this is intrinsically a part of who we are. Like, this is the way in which we live our life, and they're showing us these signs right now. Mahina, I'm going to transition to you, because so much of the business decisions that are having to be made this year in 2020, and those tough decisions that are going to have to be made in 2021 are not going to be easy for folks in any finance department or any compliance group or any investment team. How are you seeing, you know, organizations in Hawaii being more committed to being local, staying local, you know, appealing to this home base? And what are some of those themes that you're seeing that help to bring in culture and language as essential components within this economic reality that every organization is facing right now?
Sure. You know, I'm a small business owner. I own and operate 3 different businesses, of which 2 are on Oahu. It's a co-work business, so as you can imagine, we've been severely impacted in this financial downturn. And I still maintain hope. The reason why I maintain hope is because we as Indigenous women are taught that we are part of an ongoing story, an ongoing narrative. We're part of a continuum. And when we apply our sense of intergenerational being and living, we know that we cannot afford to make decisions just for today, right? That we need to also think about the decisions that we make will have long-lasting effects down the line. And so I offer that up because, you know, I too have to make some really serious, I've made serious decisions, but I'm really trying to take that far view approach in my management and in my leadership decisions. So in terms of, like, you know, some of the companies that I'm keeping my eye on and impressed with, because they seem to be kind of just trying to finding a sweet spot, that balance between long range strategy and short range pivoting or adaptation. I would say it's Hawaiian Airlines. I know that they recently had to lay off many employees, but they haven't reduced or minimized their commitment to Hawaiian language, right? In fact, I think they've increased their Hawaiian language product and experience delivery. And I think that's awesome, especially in this time. You know, many companies could see that as Hawaiian language, cultural enrichment. Let's chop that. That is not needed. And I think, I don't know, but it appears to me as a customer that they're doubling down on a few elements that are critical to Hawaii living and to their client and to their customer base. I think that's pretty remarkable because, you know, in 1896, our Hawaiian language was banned. It was banned from our public school systems. So we could no longer instruct students of all ethnic backgrounds in their native tongue, right? And then only until the latest CONCON in 1978, where, you know, we could bring Hawaiian language back, and was recognized as a second official language. The reason why I bring that up and why I want to tie that back to companies like Hawaiian Airlines, and I'm starting to see a lot more Hawaiian language signage, and in companies like Foodland. I think they're also doing a good job. I'm starting to see a ramp up in bilingualism and multilingualism, and also at Whole Foods. The reason why I say that tie line between the loss, the banning of Hawaiian language to now the current day is, can you imagine? We have tremendous trauma just from that time period in which our language was our native tongue. We were beaten. My great-grandparents were literally beaten for speaking their language. And why is that important? Because if the language is the mechanism, the vessel in which we understand our cultural identity and which we relate with one another, and we relate with our aina, then you block us off from understanding our full potential, our full intellect, and our full responsibility to one another and to our environment. So I really appreciate these large transnational companies like Whole Foods, publicly traded companies like Hawaiian Airlines, and then there's smaller outlets like retailers, like of course Sig Zane, Kealo Pico. I'm sure you folks are aware of them. Manuhia Li'i, where they're really trying in all of their products, they're really trying to put a spotlight on indigenous ways of being and values, and shedding a light on all of our assets. And I think that's what we got to do. As a small business owner, don't have a large budget, but for me, one of the things that I'm really proud about our business is that we ensure that all of our sourcing, all of our procurement, all of our contracting is with Native Hawaiian businesses only and local businesses only. We will not contract outside. Why? Because we have the expertise here. So just want to offer that. Mahalo.
Thank you so much for just giving us a great view and temperature check of other organizations that we all know about. We're all patrons of, and it's great to see a business perspective in the ways that organizations are, like you said, short-term pivoting, but keeping that long-term strategy and goal in sight. For everyone that's joining us live, I'm going to launch our second poll. Let's see. Should pop up on your screen. Go ahead and just select the answer that you think fit. We're going to open it up to a group question, and at any time, please insert the question you might have for our panelists into the Q&A feature or into the chat. We want to make this active. We want to make this engaging to you in some of the questions that might be coming up, or examples you might want to learn about. So feel free to insert those. Otherwise, we do have some other questions we have planned. And we have probably about 12 minutes or so left before the 9 o'clock hour. See lots of votes coming in. And for our wonderful panelists, my question for you will be coming into, so where do we go from here? What's on the horizon that we need to sail plan for? If you wanted to share an example of how, you imagine a healthier and more equitable Hawaii being possible in the healthcare sector, working with partnerships in education or transportation or the environment or housing, ways in which storytelling for Indigenous resilience, well-being, and survival is a part of our chant and song and dance and weaving and oration and prayer and storytelling. It's a global question out to the group. We don't have to go into any specific order. And then we'll just wait to see if other questions come in from our staff.
I think it was yesterday that I heard about, like when we look at the health of our community as a whole. And for me, for my Micronesian community, and how the experience of being excluded by policies, right? And being targeted kind of, like with the Obamacare health enrollment coming up. I mean, it's very specific for us because of certain policies that had excluded us from certain things. And when I look at the health of the whole community, and I love how somebody had said something using the word ohana, because when we use the word ohana and when we use our cultural indigenous terms and perspective, we don't see individuals and we don't see like a specific group in when we're helping. We see a whole community. And also when we look at the reality, when one community is hurting, the whole community is hurting. So I think in moving forward for adequate health for our whole community, I just wanted to, kind of like emphasize on that ohana approach instead of, maybe citizenship or those kind of things that, create barriers. Yeah.
Yeah, I want to thank you. I want to touch upon what Dean was starting to talk about. Yeah, check the judgment meter at the door, right? We want to be seen as whole, capable people. And maybe it's a paradox, when a patient comes in and they're seeking healthcare services. But I think we need to just first see folks and relate to them and see their mana, see their potential, see their gifts and see their talents. I think just taking even 30 seconds prior or a minute, and just really just checking in with one another as human beings first. I'm not sure if that's typical with health professionals, but I can tell you it'll go a long way if there's this genuine interaction and folks just want to know, do you look at me as a transaction or do you look at me as a whole person? And when we're able to create that common humanity between two individuals, I think folks are a little bit more open. Small things, I'm sure you folks do it already, but having, signage that represents many languages would be awesome. Hiring, just make, if possible, if HR can put a preference on hiring qualifications so that we can acknowledge those who are culturally competent and language competent and community, have the community connections, if we can really value that, and we see maybe bring in folks who are community bridge builders, I think it's going to really help to enhance existing strategies that you might have. And then one last thing, I'm calling in from Kona, and so for me, I really want to advocate for rural communities and neighbor island communities. And I think we also need to really localize approaches. And so if you were to bring in individuals that are akamai or smart around how, Maui people, Hana Maui people act as opposed to Hilo Hawaii Island people, I think, again, it's just going to open up a lot of opportunity for folks to really engage your services in a way that will be, I think, unexpected and surprising.
Dean, welcome back. Thank you for helping to navigate the Zoomiverse here.
I guess just adding one more thing to that is I truly believe that we need to help this next generation. And I think all four of us have been able to do that because we stood on the shoulders of giants. But help them navigate this. It's going to be Pacific American. We have systems that does not belong to us, it wasn't built for us, but we have to help this next generation learn how to navigate that and navigate it in a way that they are not losing themselves in the process. And I think that's probably the hardest thing for all of us is that, when from here on, we have to make sure that this next generation know how to navigate that and never losing themselves as an HPI people, never losing what is core to them. I am a big proponent and I'm loud and proud about it, about the university education for our young people. this next generation of people. They really need to get that backup just in case things are not going to go their way. They could always fall back on it, regroup, okay, get themselves together, and then move forward. The R3 team have talked a lot about Ohana relevant and Aina-based policies and practices. I think that that's an area we need to like push for. And maybe because it's Ohana and Aina, it'll probably be a way of preserving what is best in both worlds. We're navigating ourselves and living in an American system. At the same time, we are Pacific people. So I think merging those two and really helping our communities now to navigate that could be. Sui Fefiloi concert, the R3 Pacific sub-team, that concert is it's going to happen November 21st, I believe. And it is a way to showcase our stories. It's going to be fantastic. There's PSA in language. There is going to be music. There's going to be all kinds of things that really tells our story. And I think that that's a great way of showcasing what is important and what is important for us as Indigenous people. But what is also important for people who are not Indigenous to understand as they're moving forward, helping our communities, that this is a way that they can help our community, is to respect and leverage and embrace that in helping us move forward. So
as we celebrate this month for Indigenous peoples and the rights of Indigenous peoples around the world, this is October. This is a part of the ways in which we have these conversations. I'm going to put onto the screen, as we prepare to close, some of the traditional proverbs and sayings that we have put together to help ground us in as we start to reflect on what was shared today and as we envision forward. So I will share mine first. Ho'i ho ikamole. It's our ability to return to the root, the foundation, and the source that we continue to retain and gain that wisdom. It's actually the activation of our wisdom from that mole that I think is the most special. I will ask Valo and Josie to please share their poem and their song, and then Mahina will close us out as everyone transitions on with their day. Mahalo.
Dr. Konai Helu Thaman at the University of South Pacific in Fiji made this statement that I thought it's a wonderful way of representing the past, the present, and the future. Indigenous and Western knowledges are important in their own right. Our culture connects us to the Pacific Ocean and to one another. We share our histories, our knowledges, imagination, and our stories as we do in a variety of contexts. And it is our cultures that give us our identities. We express these in different ways in our songs, dances, paintings, weaving, sculptures, stories, sports, and even in our silences. Some stories need a brush, others a pen, and still others movement, gesture, and intonation. Being a teacher who is also a creative artist has allowed me to share my knowledge and experiences with people outside of my own culture and national boundary as I do now. As a teacher who is constantly learning, I also recognize the importance of education as the humanizing force and the value that drives the campaign for quality education that allows us to understand one another. So here to Dr. Konai Helu.
I guess it's my turn. So I chose a song and a chant that I used to dance to when I was a little girl on the small island. And I chose this chant because I feel like it's a representation of our community where we're at in time. And I look at time because when I compare the Micronesian community versus the Polynesian, like the Tongans and the Hawaiians, in terms of changes, right? Or in terms of, how would I say? Yeah, changes. And I think we're the newest and we're the youngest nation. We're still learning and we're going through these changes that, for me, what's so important to me is to defining who I am. And by looking back to where I came from. So the song is just, and then I guess also to me as a woman, role as a woman. This was a piece that I wrote, and it was published in the first literature book for Micronesian artists, and it's just to describe how the women feel when their sons that were sent off to go to college would come back to them, and they came back in a different capacity, where their role and their job was to actually come back and educate our people on this new way of life, or the Western system. And you see, Atsumare is actually Japanese, so you can talk about like our history of colonization. The person that is mentioned in here, he's one of my uncle, Masao Nakayama. He was actually half Japanese. Sakana is a Japanese word, fishing. So what literally was, in our songs and chants, they're very metaphoric. So this is what this is. It's just explaining the stage of happiness when this person came back home, and in coming home to educate us on the new life. There's more to it, but I'll stop here, and because I know I have to be sensitive to time. But thank you for allowing me to share that. Thank you.
Mahalo for sharing with us. Mahina, I'm going to transition to yours, and then I can advance the screen for the photos you wanted to share as a visual reminder for us.
Mahalo, thank you. So the Olaro no Eao that I wanted to share is actually a very old one. I can't attribute to a particular person. We see it in many traditional chants and stories. Iola oi, iola we. May you thrive so that I too may thrive, so that we can all thrive. This idea that health, actually this is a really old concept that is also new, we're most whole when we are in communion and companionship, not only with one another as individuals, but also in communion with land. And so if you can flip through the next couple of pictures, what I wanted to share briefly is just my time in training with Master Navigator Mau Piailug. He is a gift to us. He is a treasure to us from Satawal and Micronesian people. This is another story that I'd love to share with you folks at another time that really gets to some of the core tenets of our relationships as Pacific Island peoples. Next picture, please. And so this idea of Iola Oe, Iola Awe really comes from what was taught to us from the Makali Ohana. Papa Mau, the master navigator that taught Nainoa Tanton, and the man on the navigator platform, Shorty Bertelman, taught us that everything has a spirit. So everything has a spirit. The canoe has a spirit. When you endow mana into a piece, into anything, that everything has life. Everything can have mana. Everything can hold spirit. Next picture, please. So what we do is we feed the canoe. We feed the canoe first before we eat. We have 3 meals a day when we're on voyage. We feed the canoe first to make sure that the canoe will thrive first. I need to ensure that this entity, this body called a canoe, voyage canoe, will thrive first. If the canoe thrives, then we eat next, and then we thrive. There's an order, right, in these ecosystems. So this idea of I will care for you so that you will thrive, so that I too may thrive, so that we may all thrive. Lastly, the work that we engage in, your work is sacred. My work is sacred because we care for our communities, we care for our lands, we care for individuals. So with that, I want to mahalo Dr. Fox. I want to mahalo Dean Balu and Sister Josie. Thank you for the opportunity to share.
Thank you, and mahalo everyone so much for joining us today. Josie Howard from We Are Oceania, Mahina Paishan Duarte from Vai Vai Collective, and Dean Dr. Halai Valu Vakalahi from Hawaii Pacific University. 3 incredible Native Hawaiian Pacific Islander women leaders for Hawaii, making our communities a healthier place. We're so honored for you to join us today. Thank you for sharing the stories, your practices, and the ways in which you're navigating your own organizations and initiatives and important projects into the next decade and generation. We're so grateful. Thank you for the wisdom that you have imparted and shared. There's much for us to reflect on for everyone that's going to their next meetings today. For our AlohaCare team, thank you and mahalo for starting your day with us. I just want to thank our leadership for continuing to support these conversations and for supporting this initiative moving forward. And thank you to everyone who continues to work hard during a very busy time of year. We have 3 open enrollments happening basically simultaneously. It's a lot of work right now, but these are essential conversations to bring into that work. Please stay safe, everyone. Enjoy the rest of your week as we go into the holidays. Much for us to be nourished by and to reflect upon going into November. Thank you so much, everyone. Aloha.
Aloha.